Her cells, dubbed HeLa cells, used for research around the world.
Henrietta Lacks was born in Roanoke, Virginia in 1920 on a tobacco farm. Following her mother's death, Henrietta moved to Clover, Virginia in 1924, where she was raised by her grandfather. After her marriage with her husband, David Lacks, she moved to Baltimore, Maryland in 1941 with her 5 children and husband. On February 1st, 1951, Henrietta Lacks visited one of the few hospitals in the country to treat low-income African Americans, the Johns Hopkins Hospital. At the age of 31, Henrietta was complaining of both vaginal bleeding and a painful knot in her cervix. There, she met with renowned gynecologist Dr. Howard Jones, and after further investigation, he found a large malignant tumor on her cervix. Cells taken during her biopsy were later given to Dr. George Otto Gay, a prominent cancer researcher, unbeknownst to her, which was a common practice at the time. Henrietta Lacks was never told that her samples of her tissue were being removed for research, and she was never given the opportunity to decide whether she agreed to it. Her body and biological material were used without her consent, meaning she had no control over how they would be studied, shared, or distributed. After Henrietta Lacks died, the violations continued through the treatment of her family. For more than 20 years, her husband and children did not know that her cells were still alive in laboratories and being used in research around the world. They lived without health insurance and in extreme poverty. Scientists were growing, distributing, and experimenting on her cells, yet the family had never been informed that this was happening. When researchers eventually contacted members of the Lacks family, the communication created confusion and fear. Scientists asked the family to provide blood samples in order to study their DNA, but they did not clearly explain the purpose of these tests. Many family members believed the doctors might be testing them for the same disease that had killed Henrietta. Without clear expectations, her family was left unsure of what was being done with their bodies and their genetic information. Another major violation involved the issue of profit. Henrietta Lacks cells became one of the most widely used biological materials in scientific research. Laboratories and companies were able to grow the cells, distribute them to researchers, and sell them to institutions around the world. While these organizations benefited financially, the Lacks family was never compensated and had no control over the use of Henrietta's cells. The family also had no authority over how Henrietta's biological material and genetic information were studied or shared. Decisions about her cells were made entirely by researchers, companies, and institutions, leaving the family without a voice in what was happening to a part of their mother and relative. The experience of Henrietta Lacks and her family highlights how their rights, knowledge, and control were repeatedly ignored while her cells continued to be used and profited off of in the scientific community. The story of Henrietta Lacks did more than expose violations of patient rights. It also sparked an important ethical debate of how scientists conduct medical research and how patients should be protected. One of the biggest debates centered on informed consent. Henrietta's cells were taken and used for research without her knowledge or permission. As her story became more widely known, it raised serious concerns about whether patients were being properly informed when their tissues were being used in scientific studies. This debate pushed the medical community to reconsider how patients are treated and whether they should have the right to approve or refuse the use of their biological materials. Her case also raised concerns about fairness and profit in scientific research. While Henrietta's cells became one of the most valuable tools in biomedical science, her family had no control over their use and received no financial benefit. This led to broader discussions about whether it is ethical for institutions and companies to profit from human biological materials without involving the individuals or families connected to them. These debates contributed to several important reforms in research ethics. Medical institutions began placing much greater emphasis on clear, informed consent, requiring researchers to explain how samples will be used before collecting them. Ethical review systems were also strengthened, with research studies now commonly evaluated by oversight committees to ensure participants' rights are protected. In addition, Henrietta Lacks' story eventually led to changes involving the protection of her family's genetic information. In 2013, the National Institute of Health reached an agreement with the Lax family that gives them a role in decisions about the access to the HeLa cell data. This agreement recognized the family's connection to the cells and created limits on how researchers can use certain information. The legacy of Henrietta Lacks continues to influence how scientists think about ethics, consent, and respect for the people behind medical research. Her story remains a powerful reminder that scientific progress carries a responsibility to protect human rights. However, Henrietta's cancer cells behaved in a completely different way. Instead of dying, they continued to grow and divide rapidly. Even more surprisingly, they did not stop reproducing. This made them the first immortal human cell line. One of the earliest and most significant breakthroughs involving HeLa cells came during the fight against polio. At the time, polio was a major public health crisis that caused paralysis and death, especially among children. Scientists needed a way to test how the virus affected human cells and how potential vaccines could stop it. HeLa cells provided the perfect testing environment because they were reproduced quickly and could be grown in large numbers. Using these cells, researchers were able to study how the virus infected human tissue, and this work helped lead to the development of the polio vaccine, which ultimately protected millions of people around the world. The influence of HeLa cells did not stop with polio research. Over time, these cells became one of the most widely used tools in laboratories across the globe. Scientists use them to better understand and observe how cancer cells behave. This knowledge has contributed to many advances in cancer therapies. Even decades after Henrietta Lacks's death, her cells continue to contribute to groundbreaking research. Scientists still use HeLa cells to study many areas of biology. The cell line has become one of the most important tools in biomedical research and has been used in tens of thousands of scientific studies to save countless lives. Although Henrietta Lacks herself never knew the impact her cells would have, her contribution to science remains one of the most influential in medical history. Through the continued use of HeLa cells, her legacy lives on in laboratories around the world, helping scientists make discoveries that improve and save lives every day.